I'm really, really pleased to be presenting to you the headlines from a piece of research that we were commissioned to do by Woodhead, which was the evaluation of the Better Mental Health Fund. And I'm going to be talking this afternoon to some of those, to our key findings. Just to say that the report has been published today. We will put the link in the chat for those of you that haven't seen it. It has been, it's been promoted this morning on social media elsewhere, and please, I will be referring to it at various points today. And obviously, for obvious reasons, I won't be able to convey some of the detail that is in the report, so I would very much encourage you to read it. I was lucky enough to work on this project with Zoe McHale and Carrie Newbegin. They were the co-authors, and it was so we've been working together. The presentation will be in 3 parts. So what I will do is I will describe a little bit about what the Better Mental Health Fund was, what it aimed to do, and how it operated. And then there will be a video that will give you some, which will show you some of people, the beneficiaries, the people that were engaged with projects across the country. You will hear their experiences from them. And then finally, I'll get into the detail of the evaluation as the 3rd part. 3 things just to say to you. The first thing is that this is being recorded. Hope that's okay. And I need to tell you about the 3 parts, which I've already done. And then finally to say, if you can make note of your questions as you're going through and put them into the chat at the end, and then we'll be able to answer them when the presentation is finished. I'm expecting the presentation will last about 20-25 minutes, and then we'll have a good half an hour for talk. Okay, so can I have the first slide, please? Just to say a little bit how we said in addressing injustices and inequalities in mental health, both in terms of prevention and indeed in terms of care. And we work for social and racial and mental health justice. Have the next page, please, Ollie. So this is it, the Better Mental Health Fund, why we're here to discuss this today. This was set up, it was a fund set up in 2021 to address the mental health challenges arising from the pandemic. It was administered and managed by the Office for Health Improvement and Disparities. And what it was £15 million that was aimed to reduce mental health inequalities by targeting at-risk and vulnerable groups and working in 40 of the most disadvantaged areas. Next page, please. So the funding was offered to 40 local authorities, and there was a guidance offered initially about evidence-based interventions that could be implemented, that could be made local and then implemented locally. These authorities have some of the highest levels of deprivation and where mental health was at its poorest. And it covered, if you look at the spread of the projects, of the 40 projects, it covered almost all the regions of England. And the actual funding allocation from the 15 million varied from place to place and was based on population size. Next page, please. So what the interventions looked like, what the projects looked like, were a mix of things, really. They were a mix of preventative and mental health promotion initiatives, and also initiatives to support people that were either at risk of or were already experiencing mental health challenges, or for whom the pandemic had made their mental health worse. From the £15 million, there were 314 individual projects were funded, which is extraordinary when you think about it, and that they were delivered over a period of 12 months. And when we calculated the direct and indirect reach of the project, we estimate that 500,000 people were engaged in some form or another. Next slide, please. When we look at the range of projects, this by no means is a comprehensive list, but this is just to kind of convey to you the breadth of the imagination of the programs locally. That some of them focused on young people and very young people. Some of them focused on schools as whole systems. Others looked at workplaces at settings. Many of them were working with people's financial insecurity and debt. Some of them were coupling debt management with counselling. There was some very fundamental, some fundamental issues being challenged for people as they were emerging from the pandemic. There was a lot of befriending projects and projects that address loneliness, recognising the impact that the pandemic had on all of us in terms of not being able to readily access our networks. And there was also focus on physical activity and mental health. To give you some kind of insight into what those array of projects felt like for the people engaged, we're now going to share with you a short video that was developed during the rollout of the fund, which will give you insight into the impacts.
Hi everybody, I'm Sue, I'm from Healthscape CIC, and we are an informal little group who help people with their well-being by doing activities in and around the coast.
I started in January this year and I've been touring ever since, about 3 or 4 times a week with Healthscape and also with the friends that I've made from Healthscape. It's really changed my life. It's fantastic.
Been swimming with Healthscape for about 2 years now. So when it was a very small group at Broadside, and watching them kind of blossom into all these groups all the way around the coast, it's been fabulous.
Head for Health for me has been a lifesaver. I came back to Wolverhampton after 46 years away in late 2019. It's been a struggle, but with the foundation, Wolves Foundation, it's been a marvellous support, and I've met so many great guys and people I can just go and talk to rather than keep them bottled up to myself.
I did the RED course. So I have anxiety and depression, and I wanted to find out different ways of how to cope with my feelings and emotions. I learned lots of different things, like the distraction and the self-soothing techniques, like with different textured things. I met some lovely people.
When I feel down or I get anxious, I've learned how to sort of calm myself down before it gets any worse.
Since I've been coming to number 11, I've got myself unstuck, and it's helped me like my mental health and with their support and things, and they've also helped me with my financial side of things, so I feel a lot better there. And I'm still continuing to keep coming here for more reassurance and support, because I feel safe when I come here, and I look forward to coming here as well. And yeah, all in all, things are on the way up now compared to how I was sort of 9 months ago, when I was really at a low point in my life and couldn't see any way forward. But since then, things are on the up, and I'm a lot happier now, thank you very much. Yeah.
I'm really proud of the amazing relationship that we've built with both our participants on this project and of course with the incredible public health team at Hackney Council. I've seen transformation at a very grassroots level that includes new economic possibilities grounded in neighbourhoods. That is about transformation of opportunity for young black men, that's culturally competent, that looks at how they can navigate through their lives in a more holistic and healthy way. I'm so grateful for this opportunity, for this project that is really about respecting and loving and mentoring our young black men. It has shown meaningful and impactful work in a way that has good practice and difference that's tangible.
The Better Mental Health Fund helped me follow in my partner's suicide by enabling crews to provide one-to-one and group counselling. Through this, I gained the language to describe my feelings and make sense again of me, as well as being given the skills to handle emotional challenges as they arose. Access to that safe space helped me appreciate that I was not alone or unusual, and also gave me the opportunity to gain and give support to others dealing with the same emotions.
I've benefited massively from coming here, meeting a lot of a lot of like-minded people and being able to come together. Yeah, it's been brilliant.
Working with job retention through my vocational services has meant the difference for me between feeling completely isolated and alone and trapped by my mental health issues and in an unsupportive workplace to feeling emancipated and myself again.
Going in. Sam? Ready? Yep. Going in. Okay. Push yours. Just going in. Watch it go. You've got a worry to put in. Alright, going in. This water, very, very cloudy, doesn't it? And that's how our mind is when we've got things that are worrying us. Now, mind fog, exactly. Now what's happening is, all of those worries are beginning to settle down at the bottom of the jar.
The mental health first aid course raised my awareness of the different and various mental health illnesses that people experience or go through. The course really helped me to identify and spot the early signs and symptoms of mental health illnesses and how I can offer practical and emotional support to anyone who could be going through those difficulties. It was really an eye-opener. It's really something that I'm really happy that I did the course and I took so much out of it.
I attended the self-harm workshop this morning. I found it very informative and also very thought-provoking. I picked up a lot of knowledge that I didn't have prior. I think it's quite important that primary schools or primary school staff are invited onto these sessions to give them a little bit more awareness and knowledge, and I will hopefully take a lot of the information back into my practice.
So my name's Matt Jackson, I'm from Southwest Family Values and I'm a family support worker. A young person that I was allocated to, there was historical bullying, a lot of anxiety around going to school and suspected autism, and she had been out of education since September 2021. The kind of hook is that she was interested in horses, and then through numerous emails with Bernie, we managed to secure funding for therapeutic intervention using Horses for Life. And the young person has engaged in 2 sessions so far. In that very short space of time, she has benefited from it massively, and going from, in terms of viewpoint on school, has gone from she doesn't want to attend school because of her anxieties to now being open about getting into some form of education or alternative provision.
One of our young clients, Adam, it's pretty much changed his life. It's such an incredible change in the young man. It's fantastic to see.
We just want to know what difference the Better Mental Health Fund has made to you and your family.
Definitely confidence. Not as lonely. It's now going to age concern. There's a lot I can't do, but there's a lot you help me do. Just been away with my friend on holiday and she's seen the difference in me.
Oh, that's amazing.
Yeah.
So, Centre for Mental Health was thrilled to be asked to evaluate the programme. The objectives in a nutshell were that OID wanted us to capture how the funding was used, what it achieved, and indeed what can be learned more broadly for policy and practice, and also to acknowledge that it complemented local evaluations, whereas we were working at a programme level and taking a national view, that there were local evaluations undertaken as well to get a more granular understanding of what was going on locally, and they were undertaken by other researchers and institutions and local organisations. Next slide, please. So we took an appreciative inquiry approach, which basically means we were looking to distill what works, what can be what we can learn, how we can capture those sustainable aspects and factors of a project going forward, so that we can see so that we can use our learning to contribute to an ongoing improvements in mental health at a local level. And as that, we had three key elements to our research and how we collected data. The first one was data monitoring. For those of you on the call that were part of the programme, you will recall that that you returned quarterly a lot of information about what you were seeing, who you were seeing, how you were spending the money, how it was going, what changes there were in people's reported mental health. And so all that quantitative data was a big central plank of the work. We then supplemented that and asked more kind of qualitative discursive questions in a number of workshops in March 2022. And again, I can see from the participants list that some of you participated in at least one of those workshops, and that they were attended by 37 public health leads and colleagues, and that there was one, and then there was 37 public health leads and colleagues and 8 service providers, and there was at least one representative from each of the 40 sites attended one of those 5 workshops. And then there were some case studies. These were in-depth investigation, working closely with 13 case study areas, and I'll talk a little bit more about the case studies in a moment. And I just want to say here that I just want to thank all the participants, because people were very honest and open and very kind of solicitous and wanted to be part of the evaluation, which was really helpful for us as evaluators. That's not always the case. And I want to thank OHID colleagues, the regional leads who put us in touch with the right people and ensured that we could have a fair spread of who we engaged with, but also colleagues in the central office at OHID. There were several people that we worked with, Lily Makarau, we worked with Aisling Creed and several others, but in particular, I just want to mention the leadership brought here by Steph Abrar, who I think steered the programme overall much to its benefit, but also was very challenging and very supportive as evaluators in making sure that we did the best job that we could. Have the next slide, please. So the case studies. So we chose 13 case studies, and we had a set of criteria as to how we would do that. So we wanted to get a spread across the 4 quartiles of disadvantage using index of multiple deprivation. We wanted a diversity of population and intended beneficiaries, with a particular focus on racialised communities and people of colour. We wanted to capture the different projects, the different focuses of projects from primary, secondary and tertiary prevention, and also those approaches that were seeking to work across the system and bring about long-term deep change. We wanted to get a mix of size and budget, of regional representation, which was important, and a mix of seaside and inland places. None of the sites were rural. Have the next slide, please. And these were the 13. So we had Barnsley, Birmingham, Blackpool, Bradford, lots of Bs there. Barnsley, Birmingham, Blackpool, Bradford, Haringey, Hartlepool, Lambeth, Leicester, Luton, Oldham, Sandwell, South Tyneside and Torbay. And 10 of those case studies are at length on the website, and we would encourage you to look at those. And the 3 outstanding will be uploaded next week, so all 13 will be there for you to read. The case studies, as they are standalone documents, are longer and more in depth than the case studies as they've been summarised in the report. Although the summaries in the report have also been very good at illustrating some of the points that we wish to make. Next slide, please. So there is lots of discussion in the report about what was found, and then we've distilled this down to 15 key learning points, and I'm focusing on these here rather than going through the data, but I would encourage you to read the report and to read those early chapters, because it shows in a more developmental way how we got to these conclusions. But because of time today, I just wanted to focus on these. The big headline message really was that our evaluations showed that the Better Mental Health Fund achieved its purpose. In fact, it more than achieved its purpose, and that it does demonstrate in a kind of proof of concept way that investing in local councils and local communities does have those impacts that we were hoping to see, and that actually working alongside community-based organisations does deliver a tangible difference to people's lives. And you'll see that in all of the case studies. So I would encourage you to there you go. Chiamak has just posted the link to the case studies in the chat. So the big message for us is that if this kind of investment was sustained, then the benefits would be greater still. So we have no doubt that the benefits of this project were significant, this programme was significant, and that leads us to conclude that with more of that investment, we could see even more benefits. And that really what the evaluation showed, that as a proof of concept programme, as a programme that was delivered at some speed across 12 months, in the midst of the crisis of COVID, that actually this way of approaching, of devolving money locally, and then for that money to be dispersed locally to a range of organisations to meet the need of local communities, and acknowledging that those community needs will differ across the 40 sites, was indeed an effective way of operating. Next slide, please. So these are some of the more kind of granular things that we found. So we can say that funding for public mental health activity in this way did make a marked difference to local communities, and did so by building social and community capital. And what we mean by that was that for the case of some of the smaller organisations that were involved, that actually by dispersing that money to them flexibly and quickly, that they were able to respond quickly themselves, and also in tune with those local communities that they know very well, those local groups with whom they're familiar and have worked with before. It did show also that despite the short time scale of 12 months, that actually that it is possible to foster innovation, and that can be done at some speed when you're adapting evidence-based interventions or universal interventions for specific populations, given that you are entrusting that to local organisations, sometimes very local, very small groups and organisations that understand their populations and can work flexibly and at speed. It showed that in those areas where there was a lot of goodwill and strong relationships, trusting relationships between local councils and the voluntary and community sector, that actually, given that this money was, the funding was provided at some speed, that actually that really helped. Where the relationships were strong, it meant that there was trust there to be able to get the money, get the ideas down, identify some outputs, and really make an impact quite quickly. Next page, please. Okay, so obviously this grew out of the crisis of COVID and the negative impacts that the pandemic had on communities, and that disproportionate impact that it had on marginalised communities. But actually, it also showed that some of those community responses to the COVID pandemic that gained momentum very quickly and acted very effectively for local people, that they provided a real foundation for engagement. So that actually, in some ways, although this was funding that was intended for mental health and mental well-being, a lot of the work was in some form an extension of the activity that had been kick-started by the COVID pandemic and its consequences and effects. Capacity building was a key feature of many of the programmes, and that we thought this came up time and time again. And so, for example, for projects that wanted to not only develop their specialist staff, but develop training for non-specialists in mental health so that they could integrate a mental health perspective into their work, that showed great promise. But it also, and that does indeed leave a positive legacy, but does raise some questions about the long-term nature of the development of the workforce and how we keep this going, how we keep that integration of a mental health perspective at the forefront of how we support people to develop across the voluntary and community sector. Short-term funding brings significant risks. Everybody liked it. People like to be given money. People like funding. Of course they do. It enables organisations to do what they want to do that they may have been having, that they might not have had funded before. The speed at which it was and the effectiveness at which Woodhead were able to get the money out into those organisations through local authorities was welcome, but also short-term funding does also bring some risks insofar as a successful project that generates additional interest and reach for an organisation, sustaining that without, in the absence of that cash, can actually be an issue. Next page, please. There was a real point that needed to be made about small and constituted groups, about, of course, that there were larger organisations like schools and academies. There were other organisations like primary care and some of the bigger established voluntary sector organisations that were able to work effectively. But also one of the characteristics of a lot of the places, certainly in the case studies, were very small groups that had a very small focus with perhaps within a neighbourhood or a number of streets, where actually with relatively modest amounts of money, they were able to have quite an impact. And the thing that's maybe stopped them from engaging in the system previously are some of the administrative problems and burden and barriers that people face in drawing down money, small amounts of money. And that one of the things that we acknowledged was that when those barriers are removed, that actually it can be really beneficial, not only for those small organisations, but for the communities that they work with. One of the things where people were really able to get hold of the challenge, to engage with the fund and to be able to think about what kind of projects they need and how best to go about it, was where there was already a history of strong understanding of local communities through the joint strategic needs assessments, but also through a kind of those public health departments that were more attuned and more tied into local need and talking to local people. It seems that those insights were really very helpful in meaning that they could act quickly and deliver projects effectively. And that indeed where the whole vehicle of addressing inequalities, the whole strategic challenge of how to address inequalities in a local place, where that was embedded in the planning and the strategic development of the system, then it seems that there was that taste and understanding for what inequalities were and how to address them. And it meant that those places were often in a stronger position to be able to act quickly, to get the money to where it needed to be and to get the activity to where it needed to happen. Next page, please. So some areas had challenges in reaching the most disadvantaged groups in the population. So all of the places got to disadvantage without doubt, but the most disadvantaged, the poorest of the poor, sometimes were more difficult to engage. It was easier, or it was less daunting where there'd been some prior engagement. But I think there's a real message here about, with some communities, those communities that kind of bear a relentless burden of inequality and poor mental health, that to engage them can be more difficult and takes longer than a 12-month programme might allow. There's a real value in local authorities sharing resources that they've produced, and that a function of the fund was that the local authorities were in networks as being participants, and they were able to talk to each other and meet together and share resources, and that showed that that showed to have a real benefit across the piece for the 40 that were engaged. And the additional benefit, the additional challenge then was to work outside of the 40 to roll out the learning much more broadly. Point 12, timing was really important. That obviously different organisations work to a different rhythm, different seasonality of governance and meetings and sign-offs. There's also some issues in terms of delivery in schools, that school years quite clearly are not the same as other years, that they work from September onwards, and that could be a problem for schools that were trying to deliver, but were necessarily didn't have the wherewithal or the reach over the summer, for example, that other projects did quite successfully. Next page, please. Political leadership, really important. I think that's something that it's really important to acknowledge, that where there were cabinet members or outspoken councillors, elected members or others that understood what public mental health is and the value of community activation and community engagement in relation to it, that was really critical, and also critical in terms of having those political voices to ensure that any resourcing for sustained longer term rollout of these projects, that was really helpful to have those voices as well. A big question obviously about cultural appropriateness and cultural competence, and about the mental health workforce, as we know, doesn't necessarily represent the community it serves, and that when you're talking about the poorest and the most disadvantaged communities, that actually there is very much an element there around racialisation and how we make this appropriate and accessible for people of colour, and that sometimes in the absence of that culturally appropriate approach, it can hold projects back and get in the way of reaching people that really need to be reached. And finally, it was the projects we saw, the projects that sought to change systems and build capacity, projects that were really looking at what was already there and maybe adapting or elaborating projects that were established, ones that which actually, you know, the ones that work closely with ICBs were able to potentially leave a stronger legacy, and that actually beyond the 12 months of the project. So the more embedded it was into the thinking, the more helpful that could be in terms of sustainability. So 3 recommendations that might be helpful for discussion today. The first one was to say that in taking a strategic approach to addressing inequalities, it clearly is advantageous if local authorities build on their engagement with residents and listen very closely, co-produce and co-design knowledge and provision for the future. Recommendation number 2, please. There was a big question about the VCSE sector and the way in which it is funded, and the opportunities that it has to engage very effectively with local populations, but the challenges that it faces in securing funding for long enough and with enough certainty to be able to make those inroads that actually it could make if the relationship between them and commissioners was different. And the third recommendation, please, is about saying that it's this point about small groups, about actually thinking about procurement and the way in which funds are dispersed, to be able to think more creatively about how do you give small grants to those organisations that are smaller and that are able to meet need and provide insight swiftly, would be very beneficial. And that's been borne out by some of the successes that we've seen in the case study areas. Thank you.
I'll just have a look at the chat to see if we've got questions coming in. So one from Somevi. Were any of the project's case studies able to demonstrate actual reduction in demand for statutory services and or cost avoidance?
It was a 12-month initiative. So we were very much focused on impacts and what was happening in the immediate term, and learning from the way in which projects were delivered and the kind of rollout of them. To be able to do that longer piece was not always possible. I think perhaps if we went back, we might be able to do some of that. But the local evaluations very often got into the kind of granularity of what was happening locally, whereas we were focused more on kind of program level learning. But we can't say anything definitive to answer your question at this. We couldn't at the end of evaluating a 12-month project.
Thanks.
But we can use proxies like the number of people engaged, what people were saying in terms of their mental health and their well-being scores, how people were describing what their mental health was as a result of engagement and those kind of interventions compared to before. I mean, that doesn't answer your question directly, but gives you a kind of a sense in which what the impacts were for individuals and their families and their communities.
Question from Philippa. How was sustainability addressed in the projects and initiatives at the outset?
So I think there was always an encouragement that the projects were to be based upon evidence-based interventions and actions that had already been tested and shown to work, and so that was the first plank of the sustainability, if you like, a kind of certainty that they would have a footing, that they were likely to have an impact. And then what happened was, and this is where places that had the political buy-in and places that were talking to their ICBs and places that were able to articulate at a more within inequalities boards and within the realms of refreshers and reviews of JSNAs, for example, in those places, the arguments, the evidence for a sustainable approach was often more clearly able to be articulated. However, having said that, some of the projects just simply weren't funded. That might have been because they weren't particularly effective, or maybe that just locally there wasn't the money for public mental health interventions to sustain them, which is why those projects that had a focus on systems change, on training non-mental health specialists, on embedding a kind of an approach within a range of community-based activities, they were able to have some kind of iteration in the future.
And just a follow-up question from Philippa, and there's another, and were there active links with statutory services in any of the projects?
Yes, absolutely. In fact, in some projects, statutory services took the lead. So, for example, in Blackpool, there was a whole review of services for young people in schools, and it was the Foundation Trust that led a process of developing an app for young people. Although young people designed it themselves, they were the ones that supported it and funded it and committed to funding it in the longer term. So there was, I mean, I think the nature of of which kind of organisations did what, it's worth looking at the case studies, because you see there was not only a breadth of activity and focus and particular groups, but also of organisations and combinations of organisations working together. Where those organisations worked, where there were combinations of organisations working together, that seemed to be more effective where there were already existing relationships and there'd been trust had been built and they knew how to work together and get on with it. Where relationships had to start from scratch, sometimes that development was slower.
Question from Doran. I do apologise if I'm pronouncing anyone's names incorrectly. It says, congratulations, really interesting. Is there somewhere we might be able to find data on costs and outcomes?
Yeah, in the report, there's data. There's quant data in the report, and also contained within the case studies. There's that data too.
Mm-hmm. And perhaps we can just share a link again in the chat to the report so everyone has it.
I think something that I learnt is that to have cash, to actually have money in the system to do public mental health was a huge source of excitement in the local areas, to be able to have the focus from national government on something that, for those of us that work in public mental health, we're not used to having loads of cash. And actually for those areas to have money, to be able to do stuff that they hadn't been able to do previously, to be able to motivate and to engage a range of partners that have been wanting to work together for some time but didn't always find the opportunity to do so. I think that was perhaps one of the biggest learning points and the biggest joys of this project. Obviously, in the circumstances that we're working in, where resources are very tight and that everything has to be very, everything seems to be rationed in a way, or at least not abundant, then it was a shame that some projects that perhaps with a bit longer, with a bit more nurturing, could have really blossomed, but in the climate wasn't able to do so. I am hopeful that some of those projects were able to capture the imagination of local politicians and the ICBs and directors of public health and get some kind of, have in some form, in some iteration, a life beyond the 12 months of the project.
Mm-hmm. We've had another question come in, which is, with the positive outcome from this, what are the next steps? Do you think there will be further funding, maybe different areas?
I don't know if there'll be further funding. I think we've got a very compelling case here now for people, for national funding, but also perhaps for other kinds of funders, for other that may be able to, not statutory agencies, but voluntary sector agencies may be able to engage with to draw down funding. We have an evidence base here now that I think is very useful, and that maybe when priorities are being set locally, strategic priorities are being set, that this will help boost the profile of the potential of public mental health initiatives to make a difference. I think what was really striking about a lot of this stuff is that as people here will know very well, you don't necessarily address public mental health head on. Some of this was about counselling, some of this was about support groups, of course it was, but also there was stuff about helping people with their debt and their anxiety about their financial insecurity, and that the impact of that, there's a clear mental health impact. Of course, there is positive impact, but there are impacts as well on other aspects for people. And so it's the same with housing, that actually there's a material impact that's not just about their mental health. So maybe in this world of ICBs, in this world of thinking more systemically, I'm hoping this research will help people articulate, and indeed their experience of the Better Mental Health Fund will help people articulate in compelling ways the fact that with some additional thought and prioritisation, that community-based interventions of different sorts can have positive mental health benefits.
Another question has come in from Graham. The government are planning to launch a suicide prevention fund for the voluntary sector. Do you think they should be learning from this fund? And has there been any discussions with the government on the outcomes?
First of all, hi, Graham. Nice to hear from you. Yes, so Graham was very active in the research, for which we're very grateful. I know we know that this is coming. We know that the information and the knowledge that we have generated, that we've built as part of this evaluation, is in central government and is being discussed and passed around. I don't know if there's, like a lot of policy and a lot of influencing work, I don't think that those impacts are always direct. It's about creating a climate in which the narrative changes and different things can be discussed. We, of course, are hopeful that any work on suicide addresses inequality and thinks about the broader impacts of people's lives on their likelihood of being of thinking about killing themselves, rather than taking their own lives, rather than focusing endlessly on individuals, although that is an important part as well.
We do have a raised hand. I don't know. To let Annie come in.
You're on mute, Annie.
Oh, I'll just unmute.
Oh, there you go. Yeah, so I work for Woodhead and I'm based in the Northwest, and I was actually one of the regional leads, and I was around when the Better Mental Health Fund was around. So just the question around the sort of the suicide prevention grants. So I sit on the sort of policy teams meeting, and we've been talking about the learning from the Better Mental Health Fund, because I think, David, you were very kind when you were talking about the timescales. I think it was really tricky for lots and lots of people, and so we've been sort of reiterating some of those kind of learning points for this grant. I think it's still going to be tricky in terms of timescales. I think people are going to have more. I think people are going to have more time than they had for the Better Mental Health Fund. I don't think it's going to be as complicated in terms of the monitoring. And I think part of that is because the amount's probably going to be smaller, and it's a smaller amount, and it's rather than it being for kind of local authorities, it's for voluntary sector organisations, so the expectations are slightly different, but there still will be due diligence and there'll still be a whole process. So absolutely, and there's me and Glyn who sit on that national working group, and Kate O'Hagan, I'm not sure if I think Kate's on leave, and we have been banging on about the learning from this. So
thanks, Annie.
Eyes crossed.
Brilliant, thank you.
Is that all right?
Super.
I think that's all the questions that we have, unless anyone wants to sneak one in towards the very end. If not, we'll wrap up a little early and let everyone go and get some lunch if they haven't already. Anything you want to say, David?
No, just thank you so much again to everybody, all the participants, people turning up today, people from Woodhead. Annie was always great throughout the whole process. Everybody really, I think there was a lot of goodwill about this initiative, and everybody wanted it to be as successful as it could be, and there were some clear successes. Please read the report, look at the case studies, look at the vlog and the podcasts and the other bits and pieces that are on our Better Mental Health Fund page at the centre, and stay in touch. And I'm hoping that there's stuff in the report that will help you locally in upping the ante for public mental health and inequality. Thank you.